Hello, and welcome to this course on dealing with trauma. The future of trauma treatment is exciting, with emerging therapies and ongoing research into the biological and genetic factors that influence trauma recovery. As our understanding of the brain and body evolves, new methods and innovations are offering hope for even more effective treatments. This chapter explores some of the most promising emerging therapies, recent research into genetic and neurobiological factors, and the innovations transforming trauma care. As the mental health field evolves, new treatments for trauma are being developed that offer unique approaches to healing. Two of the most promising are MDMA-assisted therapy and virtual reality exposure therapy. MDMA-assisted therapy. MDMA 3,4-methylene-dioxymethamphetamine, commonly known as ecstasy, is being studied for its ability to reduce fear responses and increase emotional openness in therapy. Under the supervision of trained professionals, MDMA is administered in a controlled setting, allowing individuals with post-traumatic stress disorder to process their trauma without being overwhelmed by anxiety. How it works. MDMA reduces activity in the amygdala, the brain's fear center, while increasing feelings of trust and connection. This creates an ideal state for trauma processing. Patients often report feeling more connected to their emotions and able to revisit traumatic events without being re-traumatized. Benefits. Studies have shown that MDMA-assisted therapy can lead to significant reductions in trauma symptoms, with some patients experiencing long-term improvements after just a few sessions. Current status. MDMA-assisted therapy is currently in advanced clinical trials and may soon become an approved treatment for trauma. Virtual reality exposure therapy, VRET. Virtual reality technology is providing a new way to deliver exposure therapy, a key treatment for post-traumatic stress disorder. With VRET, individuals are immersed in virtual environments that simulate trauma-related scenarios. This controlled environment allows them to confront and process their trauma at their own pace. How it works. In VRET, patients wear a VR headset and are guided through a virtual environment that mimics the settings or situations linked to their trauma. The therapist controls the level of exposure, gradually increasing intensity to help patients build resilience to their triggers. Benefits. Virtual reality exposure therapy offers a safe and controlled space for individuals to confront trauma. It is especially helpful for veterans or individuals whose trauma occurred in specific environments, such as combat zones. Current status. VRET is increasingly being used in clinical settings, with research showing positive results in reducing trauma symptoms. Both MDMA-assisted therapy and virtual reality exposure offer exciting new ways to approach trauma treatment, and ongoing studies continue to explore their long-term effectiveness. The field of trauma treatment is also advancing through research into the genetic and neurobiological factors that influence how trauma affects individuals. Understanding these factors can help personalize treatments and provide more targeted care. Genetic research. Studies suggest that genetics may play a role in how individuals respond to trauma and develop post-traumatic stress disorder. Certain genetic markers have been linked to an increased risk of post-traumatic stress disorder, while others may offer resilience against trauma. Genetic vulnerability. Some individuals may be genetically predisposed to a stronger stress response, which can make them more susceptible to developing post-traumatic stress disorder after traumatic events. Potential for personalized treatment. As genetic research advances, we may be able to develop personalized trauma treatments based on an individual's genetic makeup. This could involve tailored medication plans or specific therapeutic approaches that align with their unique biological responses. Neurobiological factors. Research into how the brain processes trauma is also revealing new insights. Scientists are studying the structure and function of the brain in people with post-traumatic stress disorder to better understand how trauma affects areas like the amygdala, hippocampus, and prefrontal cortex. Brain imaging. Brain scans of individuals with trauma show differences in the way their brains process fear, memory, and emotions. Understanding these differences is helping researchers develop more effective treatments, such as neuromodulation techniques that target specific brain regions. Neuromodulation techniques. Techniques like transcranial magnetic stimulation, TMS, and deep brain stimulation, DBS, are being studied for their ability to alter brain activity in ways that reduce trauma symptoms. Research on the genetic and neurobiological aspects of trauma is still in its early stages, but the potential for breakthroughs in understanding and treating the condition is significant. In addition to new therapies and research, there are several innovative approaches emerging in the broader field of trauma care. These innovations focus on improving access to treatment and enhancing the quality of care for individuals with post-traumatic stress disorder. Teletherapy and online platforms. With advancements in telehealth, individuals with trauma now have greater access to therapy from the comfort of their homes. Online platforms provide virtual counseling sessions, which are especially useful for those who may have difficulty traveling or accessing in-person care. Benefits of teletherapy. Teletherapy offers greater flexibility and privacy, which can encourage more individuals to seek help. It also allows for continuity of care, even when life circumstances make in-person sessions difficult. Wearable devices for symptom monitoring. Wearable technology, such as smartwatches, is being used to monitor trauma symptoms in real time. These devices can track heart rate variability, sleep patterns, and stress levels, providing individuals and their therapists with valuable data on their emotional and physical well-being. Oh, how wearables help. By tracking physiological responses to stress, wearable devices can alert users when their anxiety levels are rising. This allows for early intervention, such as using grounding techniques or contacting a therapist before symptoms escalate. Peer support and community-based programs. Peer support groups and community-based programs are gaining recognition for their ability to complement traditional therapy. These programs provide individuals with trauma a sense of belonging and understanding by connecting them with others who have experienced similar trauma. Benefits of peer support. Talking with peers who understand the challenges of trauma can reduce feelings of isolation, increase motivation for treatment, and provide practical coping strategies. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our Mental Wellness Hub on the Happy app. Click the links in the description. Finally, although this course was free for you, it was not free to get it to you. Please consider giving a small donation to help spread these courses around the world to those most in need. The link is in the description. See you in the next lesson.